Endometrial cancer refers to cancer of the inner lining of the uterus. It claims the lives of more than 10,000 women in the United States every year. The most crucial thing with this type of cancer, as with other cancers, is catching it early. If caught early, more than 90% of women can recover. This cancer primarily affects perimenopausal women, but may also affect women that are predisposed to developing this type of cancer due to genetic or other factors. It's crucial, therefore, to number one, provide proper screening for women who are at high risk of endometrial cancer. And also, it's extremely important to properly screen women who are perimenopausal and who present with the typical signs and symptoms of endometrial cancer, which may include abnormal uterine bleeding. The most common type of medical malpractice case involving uterine cancer is one where a woman who does present with the warning signs and symptoms of endometrial cancer does so to a medical provider, and that medical provider does not perform or recommend the proper testing that should be performed. Typically, this involves a biopsy or DNC, which stands for dilation curettage, in order to assess for abnormal uterine bleeding, for example. That biopsy, which is a sample of tissue taken from that inner lining of the uterus, could be examined under a microscope by a pathologist, which is another type of physician, who can determine whether or not cancer is present in that sample. This is the most important thing that can be done in order to try to reduce the number of people who die from endometrial cancer in the United States. It is also important to note that there are syndromes in medicine. Some of them are referred to as hereditary ovarian breast cancer syndromes, which involve certain genes women may have, which render women at higher risk of developing endometrial cancer. Women can develop that cancer at earlier ages as well, not merely at perimenopausal ages, but rather at 30, 40, and even earlier than that. Therefore, there are specific operations which are recommended to such women to actually increase their lifespan and make sure they don't die prematurely. Therefore, it becomes extremely important for doctors, and it's typically gynecologists or family medicine physicians, to be aware of these guidelines. And if they fail to follow these guidelines, that can have a huge impact on any one particular woman or family's life. It's our role to advocate on their behalf if such a thing happens.